Welcome back to Insight. Hi, I'm Jack Cameron. This is Megan from Aging and In-Home Services. Now we're talking about what Medicare covers, who covers it, what's the difference between Medicare and Medicaid. These are all the things my wife told me to ask in one little ball of a question.
That's okay, because that is a question that a lot of people ask. I think that the names are confusing. I'm going to give everyone that is absolutely correct. Medicare and Medicaid are different things. And so let's kind of go over those things first. So Medicare is the federal insurance program that you receive once you turn 65. There are other qualifying events and diagnoses that could fall under that, but they're unique to people. Typically, you have to be on disability for 2 years, or you have to be in end-stage renal failure. So those are two things that might get you eligible for that. Medicaid is a federal funded but state distributed insurance program for individuals who meet low income. So
you lost me there for a minute.
I know.
Okay. You watched you have a man at home, don't you?
I do. So I saw, yes. So Medicaid, it's federally funded, but it's state distributed. So what that means is that while the federal government puts in place different regulations, the state distributes the money based on different criteria on the poverty levels that are in its own state. I know this is a lot of information. So basically, all you really need to know is that if you have low income, or if you think that you might be below the poverty level, give us a call, because you might be qualifying for Medicaid. And so when you qualify for both, then you're considered a duly eligible individual, and the benefits then again start to grow and start to pile on top of each other. Because if you're an older adult who has Medicare, and then you're also an older adult who has low income, you're considered a duly eligible individual.
Now, so is that then helps them find what they need?
Correct, because Medicare is made up of 4 parts. So there is Part A, Part B, Part C, and Part D. Part A is your hospital insurance. So those are like for emergency stays, hospital inpatient, different procedures like that. Part B is healthcare costs. So your typical preventative visits, your outpatient services, things like that. I'm going to skip Part C for a second and come back to it. Part D is prescription drugs. So that also is under Medicare, but it's a different program that you'd have to buy into sometimes. And then Part C is Advantage plans. So, I know this is a lot.
Do you have something with puppets?
I know. I need to put together a jingle for sure. That's what I'll start working on. But essentially, Medicare, while you're eligible based on age, there are also different pieces based on income that might pay for some things. There are different subsidy programs. So it's good to know if you do qualify for Medicaid, because that would kick in to pay for the outlying services. Medicare Advantage plans, those are the plans that are sold. So those are, Medicare Part C is not a federal program. It's a private insurance program. So insurers like the big names that we see, United Healthcare, Anthem, different programs like that, they have their own Medicare Advantage plans. So they take bits and pieces from the Part A and Part B, and they really look at what your diagnoses are, and then they get you a yearly contracted rate so that you pay every month, but your services are covered. Whereas opposed to Medicare Parts A and B, it's a fee, like not a fee for service, but you pay as you go. There's not a monthly premium that you pay.
It still seems like I'm going to need help, and a lot of people are going to need help negotiating this to know what is right. And I surely appreciate that your office is there, Aging In-Home Services, to help so much with this.
It is something that I didn't realize how many questions I would have. Granted, I'm not an older adult, but I know plenty of them, and it's good to have that information and not walk through it by yourself.
Thank you so much. If you want to keep up with all that is happening with Aging and In-Home Services, well, you can text JOIN AIHS to 22828 to become part of their monthly e-newsletter list. And for other information, you can head to agingihs.org.